things like that that improve access in a revenue and cost neutral way are certainly things that we could look at together. Thank you. Thank you. This panel is excused.
Councilmember, to follow up on your request earlier about the West Side Highway, it was cleaned 7 times in the last 12 months.
I now open the hearing for public testimony. I remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant at Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant at Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on today's hearing topic, strict cleanliness or any of the legislation on our agenda today. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant at Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. For our first panel, we're going to call up John Sheba, Josh Canero, Eric Goldstein, and Janelle Scott. If you hear your names, come on up. Justin Wood, you can come up too. And Lacey. All right, we'll start with Janelle.
Hello? Okay. Hi, good morning. My name is Janelle Scott, and I'm the Climate Director at Align. We are an organization that brings together labor, climate, and community for a more just and sustainable New York. And I'm here testifying on behalf of the Transform Don't Trash Coalition as well, which is a coalition that has been working to fight and transform New York's commercial waste industry for over 10 years. So today, we just want to say thank you to Chair Abreu and the members of the Sanitation Committee for the chance to testify today. I'm here to testify in strong opposition to Intro 1349 because we believe this is a wholly unnecessary legislation and that if passed, it would fully undermine Local Law 199, which is the Commercial Waste Zone Program. We oppose this bill for the following reasons. One, it would provide a broad exemption to healthcare facilities and other generators of medical waste by redefining the definition of commercial establishment, and that would include any generator of regulated medical waste. And this is something, as we've heard earlier, is already excluded from the Commercial Waste Zone Program and already permits hospitals, nursing homes, and other generators of waste to contract with any specialized medical waste hauler of their choosing. Secondly, hospitals and healthcare facilities generate a massive amount of non-medical waste, and so further exempting them from the law doesn't incentivize them to reduce their waste, and it further hinders the full benefits that we would see from the Commercial Waste Zone Program. Thirdly, exempting medical waste facilities undermines the extensive RFP process that DSNY has already undergone, which vetted numerous haulers that were assigned various zones. And this process also ensured that the haulers had environmental and worker safety practices and that their quality of service was up to standard. And so that means that any facility could either choose a hauler that was not approved in this process or choose a hauler that received a different zone in a completely different area. And so that would also not realize the benefits of the commercial waste zone program. I have just one more short paragraph.
You can finish.
Thank you. And then lastly, something that we'd also like to note around the affordability notes that were mentioned earlier is that price was a key factor that was within the DSNY selection criteria. And this was done in order to maximize the affordability for all businesses and entities across New York City. And so the commercial waste zone program will definitely protect customers from unreasonable price increases in waste services by setting maximum prices and also permitting customers to negotiate those prices with the designated haulers that have been assigned a zone, so they're able to choose a price that works for them or to negotiate a price that works better for them. So thank you for the opportunity to raise our concerns, and we look forward to working with the committee to create a higher standard for environmental safety and customer protection. Thank you.
Thank you for your testimony.
Good morning. Good morning, Chair Abreu and Council. Thank you for holding this hearing. I'm Eric Goldstein, New York City Environment Director at the Natural Resources Defense Council. NRDC strongly opposes Intro 1349, which would exempt a broad category of waste generators, hospitals, labs, doctors and dentists' offices, veterinary offices, nursing homes, from the city's landmark commercial waste zone statute. This bill would create a giant loophole in one of the most important solid waste reform statutes passed by the council in recent decades. It would be flatly inconsistent with Local Law 199 of 2019 to reduce unnecessary truck traffic and improve public safety. In enacting the commercial waste zone statute, the council specifically considered how to deal with medical waste and which generators of what waste should be excluded from coverage under the law. The council concluded that commercial waste covered by the waste zone statute would include trade waste, which is all putrescible and non-putrescible waste from commercial establishments, but not medical waste. However, when the council excluded medical waste from the waste zone system, that's very different from excluding generators of medical waste, as Intro 1349 would do. Intro 1349 is inconsistent with the objectives of the waste zone statute. It would increase truck traffic, it would increase congestion, it would increase air pollution, and it would undercut the economic model of the waste zone statute, which is premised on no more than 3 quarters per zone to handle trade waste. NRDC urges the council to send this ill-advised piece of legislation directly to the morgue, and we thank you for your attention.
I appreciate your testimony, Eric, always. Lacey.
Good morning, Chair Abreu, and thank you for holding this hearing today. I'm here representing Brooklyn Borough President Antonio Reynoso, who, as chair of the City Council Sanitation Committee from 2014 to 2021, created the Commercial Waste Zones program alongside DSNY. Today, he wants to join DSNY, labor unions, commercial carters, and the advocates in expressing his strong opposition to Intro 1349. While Borough President Reynoso has voiced continued frustration with DSNY's rollout of the CWZ program, he remains committed to its full implementation. When all 20 zones are active and operating, the city will see a dramatic reduction in truck traffic and associated emissions from the waste industry, safer streets, improved worker protections, and less waste going to landfills. These goals remain as important, if not more so, as when the CWZ bill became law in 2019. Yet Intro 1349 would dramatically undermine these goals. This bill would change the definition of commercial establishment in the CWZ law with the intent of exempting any business that generates medical waste from having to contract with a selected carter. This is simply not necessary. Medical waste is already exempted from the CWZ law due to its unique pickup and disposal regulations. It is true that medical facilities such as hospitals generate both medical and non-medical waste. However, it is not necessarily true that this means they must contract with more than one carter. Many carters within the CWZ program offer specialized medical waste services or have the ability through the program to subcontract with a hauler that can. Changing the definition of commercial establishment in the law is overly broad, such that it would exempt thousands of businesses citywide from complying with CWZ. According to the State Department of Environmental Conservation, regulated businesses that generate medical waste include hospitals, clinical laboratories, veterinarians, funeral homes, nursing homes, home health providers, physicians' offices, research laboratories, pharmaceutical companies, colleges and universities, blood banks, company infirmaries, and correctional facilities. This bill would create a dangerous precedent for carving out businesses from complying with the CWZ law unnecessarily, leading to more vehicle miles traveled, more greenhouse gas emissions, less oversight of worker safety and safe driving practices, and more waste in our landfills. Thank you.
Thank you, Lacey. Justin?
Good morning. Thank you, Chair Abreu. Thank you, Council. And thank you, members of the committee, for this opportunity to testify. I'm Justin Wood, Director of Policy at New York Lawyers for the Public Interest. We're already also a founding member of the Transform Don't Trash New York City Coalition. In addition to all of the reasons we oppose Intro 1349, because it would undermine the promises of increased safety, increased worker protections, increased recycling, waste reduction, better investments in recycling facilities, cleaner trucks. I wanted to stress that this broad exemption for the healthcare industry, which seems to be couched in a reasonable exemption for specialty hazardous medical waste, that's already exempt from Local Law 199, as we've established. And healthcare facilities like hospitals are actually massive generators, probably among the biggest generators in any waste zone and in our city, of non-medical waste, including plastics, huge amounts of food waste, huge amounts of paper, and other materials, construction and demolition waste. So in excluding this entire industry from a law that's supposed to just now be implemented, and we're speeding up implementation, thank you, Chair Abreu, to your efforts, we'd be exempting some of the biggest producers of solid waste from a system that for the first time is going to require them to track how much waste they're producing. For the first time, incentivize the haulers and customers to work together to reduce those waste streams, and of course produce all of the benefits of increased safety, reduced vehicle miles traveled, reduced VMT. We've seen studies that show that about 85% of waste generated by hospitals is actually non-medical waste. I would also just say on a personal note, this is a huge industry, a huge employer in New York City. Most New Yorkers have experience as either patients or workers, and we can see there's a massive amount of low-hanging fruit to reduce food waste, plastics, paper, and everything else that you see inside a hospital. So we hope our colleagues in the healthcare industry would actually see commercial waste zones as an opportunity to start tackling these big challenges and producing public health benefits of reduced waste together. Thank you.
Thank you. This panel is excused. Aaron Piscoping, Andrew Dahl, Josh Harif, and Josh Canero. If I butchered your name, my apologies. If you haven't filled out a speaker card, you may do so now with a sergeant at arms, if you would like to testify. And I'll start from my left. You may begin.
Thank you. Good morning, Chair Abreu. My name is Erin Piscopink, and I'm testifying today on behalf of the New York City Bid Association, where I serve as the association's co-chair. I'm also the executive director of the Soho Broadway Initiative in Manhattan. The Bid Association proudly represents all of the city's 77 bids. All of our bids are deeply concerned about compliance with the city's containerization mandate, and note Intro 1279, which is being considered today. One of the core services offered by bids is supplemental sanitation. Our clean teams sweep the sidewalks to remove debris and change out the corner basket liners. And while, as you noted in your remarks earlier, the trash we manage doesn't magically repel rats, but it is different in that it's not trash generated by the bids, it's trash managed. And without our efforts, that we would have a lot of overflowing cans, which were a major topic of conversation today, attract more rats, filthy streets in our busiest corridors, and increase the need for city services. You've heard from us many times over the last years. We've grappled with the DSNY rule that changes how bids operate. barring us from leaving bags at the corners as we've done for decades. In that time, we've continually expressed that we're not against moving toward containerization, but rather impressed upon the council and city agencies that there are challenges in operationalizing this at scale, particularly with funding. I want to thank you for your advocating for $5 million in the FY26 budget, which will allow more bids to become more compliant faster. The Bid Association has and will continue to work in partnership with City Council members and staff and DSNY as we ensure timely use of these funds and broad compliance with the mandate. As such, we're here today to share a point of concern in our ability to become compliant. Given the length of time it takes to contract with the city for discretionary funds, procure, site, deploy, and operationalize these containers, it's highly unlikely most bids will be in full compliance when the mandate fully takes effect in January. We take DSNY at their word and deeply appreciate the flexibility that they're providing in refraining from finding bids who are acting in good faith to comply. We understand good faith to mean any bid that's anywhere in the process actively working toward compliance. Thank you. However, this position is not codified, and we're cognizant that a new mayoral administration with a different understanding of compliance could take office on January 1st, leaving bids open to incurring fines as we keep the streets of New York clean and move toward compliance. This committee, DSNY, and BIDS share the common goal of keeping our streets clean and safe. Thank you for your time and continued support.
Thank you. And the bids have been really great partners in our success in achieving the $5 million for you all. And we want to also make sure that DSNY is getting the resources to the bids in real time to making sure that you all are able to comply. So I really appreciate your testimony.
Thanks. Good morning, Chairman Abreu. My name is Andrew Dahl, and I serve as the Vice President of Emergency Preparedness and Response at the Greater New York Hospital Association. And as you may know, we represent all public and voluntary hospitals here in New York City. And we're here to talk about Introduction 1349 and support that legislation. Our hospitals navigate a very complex system of over a dozen different waste streams and patterns, and that exceed just the clear bag waste as part of CWZ, and that includes infectious medical waste, controlled substances, radiological, and pharmaceutical waste, and so very complex. And as many of these waste streams are already regulated, much like the large number of regulatory requirements we have around sanitation and infection control to safely deliver patient care, our systematic approach as hospitals, we often use a single healthcare waste management service who understand those intricacies, can understand the different waste streams, and can responsibly dispose of all waste streams safely. And New York City hospitals, both large and small, operate networks throughout the city, and they traverse many different zones, and that has some complications to it. And where the law really is responsive to the needs of the hospital is the additional contracting and management that's required, which translates into increased costs for hospitals as it relates to waste streams. Hospitals are committed to the goals of the CWZ program, and this bill is not meant to undermine them. Hospitals have already made their waste management systems rather efficient, containerizing their clear bag waste and ensuring it is directly shipped to its final disposition directly without any intermediary. And that supports the goals of reducing carbon emission and truck traffic. And these are especially important today as we're facing financial headwinds with the recent federal passing of the One Big Beautiful Act. And as my colleague Elizabeth Wynn testified on Monday, New York State hospitals are facing over $8 billion worth of cuts over the coming years. And that's from lower health insurance reimbursements, Medicaid cuts, and increases in uncompensated care. So we feel it's prudent here to find any cost savings that hospitals can find so we can better direct those limited resources to where it matters most, treating patients and the staffing to support all of that. Thank you very much for your time today.
Thank you for your testimony. Next.
Good morning, Chair, and good morning, Committee. My name is Josh Harriff. I serve as the Market Vice President for Action Carting, a subsidiary of Interstate Waste Services. I want to thank you for the opportunity to deliver testimony respectfully opposing the adoption of Introduction 1349, a bill which intends to exclude generators of regulated medical waste from the Commercial Waste Zones program. The historic passage of Local Law 199 ratified specific goals for New York City's commercial waste and recycling industry, including a reduction in vehicle congestion and emissions, the standardization of safety-focused operational practices, and an elevated commitment to customer service through transparent rates and written service agreements. Intro 1349 actively threatens the achievability of Local Law 199's key goals by introducing unnecessary exemptions for commercial businesses and a viable loophole for non-awarded haulers to continue operating without CWZ standards. The broad exemption of any generator of regulated medical waste from the CWZ program is an overcorrection to a non-existent problem. Per New York City's administrative code, regulated medical waste is already exempt from the CWZ program. This distinction affords generators of regulated medical waste the ability to contract a specialty hauler to properly manage the specific materials collection and disposal. However, entirely exempting these establishments from CWZ requirements neglects the volume of commercial refuse and recycling that they still produce. Hospitals, nursing homes, veterinary offices, blood banks, funeral homes, tattoo parlors, and several other businesses produce regulated medical waste. However, they also produce non-specialty waste and recycling. Medical waste collection companies can continue collecting these customers' medical material without Intro 1349. However, this bill would allow commercial haulers without CWZ awards or standards to continue collecting non-medical commercial waste and recycling from these establishments, effectively contradicting Local Law 199's consolidation, operations, and customer service focused goals. Furthermore, this workaround for commercial businesses would irrevocably fracture the enforceability of the CWZ program. Thank you.
Thank you for your testimony.
Good afternoon, Chair. My name is and committee. My name is Joshua Carrero. I'm the business manager of Local 108. I'm here to strong opposition of Intro 1349. The commercial waste zone program has delivered real wins for sanitation workers: safety, safer jobs, better wages, and stable career opportunities. We should be building on that progress and not creating loopholes to weaken it. Regular medical waste is already exempt from the law. Hospitals and nursing homes can already contract with specialized companies for that waste stream. What this bill does is goes further and exempts entire healthcare facilities, even though most of their waste is ordinary trash and recyclables. For exemption would undermine the CWZ program by allowing big institutions to bypass safety and labor standards, undercutting worker gains, creating more truck traffic and emissions instead of efficient routes, stripping designated haulers of major customers and threatening their investments in cleaner trucks and better jobs. The council already weighed this issue when it passed Local 199. The bill reopens that debate and risks undoing years of progress. I urge you to reject Intro 1349 and keep CWZ strong for workers, communities, and for our environments. Thank you.
Thank you. This panel is excused. I will now call on John Sheba from Teamsters A13. Are you here, John? And Christopher Leon Johnson. You may go, Mr. Leon.
Yeah. Hello, Chair Abreu. My name is Christopher Leon Johnson, and I'm showing support to Intro 1370, which is sponsored by Stevens. And the reason I support this bill because why we have to submit this it should be online. I think that this should be worked online, but at the same time, the sanitation department should be working on protecting the people that report this stuff, because there are people that don't take it lightly when it comes to being fined by any department, including OATH. And I'm fearing that people might get retaliated against with this bill if they start doing stuff online. And another thing I want to show support is to Intro 536 2024, hosted by Justin Brannon. I want to say this, that I think that certain food stores like Pret Manager and any big box store that do business with the city need to be able to start giving out food to the homeless, excess food to the homeless directly, instead of going through these nonprofits like City Harvest and the Food Bank of New York City. I believe that any person that's homeless, I believe the nearest store that's around here is Starbucks. Right outside City Hall. They should be able to give out their bagels and any type of foods that is perishable to the homeless after they close or after a certain time, like lunchtime. I support this bill 100%, and I have 30 seconds left. I believe that the BIDs need more support with the city council, and they shouldn't be scrutinized by the city council for trying to do their best to clean their area and clean their neighborhood, because why do we give all this money to these nonprofits like the Doe Fund and all these that don't do this, only hire felons to do all the work, instead of just giving money direct to the BIDs to do the work, and they can hire the felon themselves. And thank you so much, and enjoy your day.
Thank you for your testimony, Mr. Leon Johnson.
Yeah, thank you.
On Zoom, we have David Biederman.
You may begin.
Good afternoon, Mr. Chairman. My name is David Biederman. I'm testifying in opposition to Intro 1349. I'm the president of Biederman Consulting and serve as the sole industry representative on the Department of Sanitation CWZ Task Force. And I provide safety training to commercial waste zone awardees on a regular basis, including as recently as last week in Brooklyn. The Department of Sanitation and others have testified about how Intro 1349 would undercut CWZ's efforts to reduce vehicle miles traveled, truck traffic, and emissions. These are all valid reasons to oppose this misguided legislation. Let me focus on another one: safety. Intro 1349 would interfere with one of the core goals of CWZ, which is improving worker safety for commercial waste collection employees and improving street safety for pedestrians, bicyclists, and other road users. Local Law 199 and the CWZ regulations issued by Sanitation include stringent new safety requirements, including training, incident reporting, and telematics reporting. Why would this committee even consider creating an exemption from the law that allows companies to evade these requirements, which are today making New York City streets safer and have reduced accidents and fatalities involving the commercial solid waste industry? Sanitation is in the early stages of implementing CWZ, but one of its notable achievements already has been a substantial reduction in fatal collisions involving commercial garbage trucks operating in New York City. Prior to Local Law 199, there were 5-6 fatal accidents annually, with several workers killed. There has not been a private sector solid waste collection employee killed on a route in the 5 boroughs for several years, knock wood. The race to the bottom, to the extent that it ever existed, is effectively over. CWZ awardees incur substantial costs to comply with the safety requirements embedded in Local Law 199. This committee and the City Council should reject efforts to exclude companies that collect solid waste from medical waste generators from those obligations. As many have mentioned, this would create a huge loophole in CWZ, potentially exempting tens of thousands of customers from the program, and importantly, endangering solid waste collection workers,
Time has expired.
as well as 8.5 million New Yorkers. Thank you.
Thank you. Next on Zoom, we have Louis Dubuque.
There we go. Sorry about that. There we go. Sorry about that. Good morning, Chair Abreu, members of the committee. My name is Lou Dubuque, and I'm here on behalf of the National Waste and Recycling Association. Our members are the private haulers who make the commercial waste zone possible. Collectively, we service commercial customers across New York City, employing thousands of New Yorkers, investing millions of dollars to build safe, efficient, and environmentally sound collection systems. We strongly oppose Introduction 1349. This bill would exempt generators of regulated medical waste from the commercial waste zone system. While we recognize that medical waste is highly regulated at the state and federal levels, carving out entire categories of customers undermines the very foundation of the CWZ framework. The city created the CWZ under Local Law 199 of 2019 to bring order, efficiency, and accountability to the collection of all commercial waste. NWRA members competed for contracts on the understanding that all commercial establishments in a zone would be covered. Every exemption chips away at that model, eroding fairness and threatening the financial viability of the system. Hospitals and health facilities generate not just medical waste, but also large volumes of recyclables, organics, and regular refuse. By exempting them from the CWZ program, this legislation removes a significant customer base that helps support zone-wide operations and keeps rates stable for everyone else. That means fewer resources for recycling and organics diversion and higher costs for small businesses that remain inside the system. Perhaps most troubling, this bill would set a dangerous precedent. If one industry is allowed to opt out, others will surely follow. that would unravel the CWZ framework piece by piece, leaving us with a patchwork system that undermines the city's policy goals and destabilizes investments haulers have already made. In short, NWRA members have done everything DSNY and the City Council asked them. We competed, we invested, and we built operations around the promise of a fair, comprehensive zone system. Introduction 1349 would break that promise. For these reasons, we urge the Council to reject this bill and instead continue working with DSNY, BIC, and industry stakeholders to strengthen, not weaken, the commercial waste zone program. Thank you for your opportunity to testify today.
Thank you for your testimony. We now have Charles DiPolito on Zoom.
Thank you, Chair Bro and council members, for the opportunity to speak on Intro 1349. My name is Charles DiPolito Jr., owner of Approved Storage and Waste Hauling, a commercial and medical waste carting business that has operated in the New York City region since 1996. I've appeared before this committee in the past to alert you to what I believe was a significant oversight in the CWZ program as it related to healthcare facilities, which is that the solid waste industry goes further than regulated waste categories and considers healthcare or institutional waste a special category. Intro 1349 artfully recognizes that reality. Healthcare facilities can include hospitals, nursing facilities, and community clinics. Many generators, such as Northwell and Montefiore, are concerned about the CWE policy because they want to retain a single hauler for their vast network of hospitals, offices, and nursing homes, which in many cases span multiple boroughs. They're liable if contaminated or commingled waste arrives at a facility which is not permitted to handle institutional waste. And they're comfortable with the subset of companies with the expertise to differentiate regular medical waste from institutional waste that has been contaminated. And most urgently, they are getting hit by devastating funding cuts and do not want to undo the savings they've achieved by consolidating waste operations. Through Councilmember Dinowitz's proposed legislation, you're providing flexibility to the healthcare sector, which includes small community health centers, nursing facilities, in addition to larger hospital campuses. You're also ensuring these complicated waste streams are handled safely. I strongly recommend Intro 1349's passage and also recommend that when it passes, it takes effect immediately to ensure healthcare facilities have clarity as to the CWZ program continues to roll out. Thank you all.
Thank you for your testimony, Mr. DiPolito. Seeing no one else in person or on Zoom signed up to testify, this hearing is hereby adjourned.